You hear a pediatrician talking to a patient called Mihira. You now have 30 seconds to look at the notes. Good morning, Mihira. How can I help you today?
Good morning, Dr. D.A. I'm really worried about my son, Milan. He's been having these terrible coughing fits, and I'm not sure what to do.
I'm sorry to hear that Milan is unwell. Let's start from the beginning. Can you describe his symptoms for me?
Yes, certainly. It all started a couple of nights ago. He woke up in the middle of the night with a very harsh, barking cough. It sounded almost like a seal barking, and it really scared me. He also seemed to be struggling to breathe.
That sounds quite distressing. Has he had a fever or any other symptoms?
He did have a mild fever the first night, but it hasn't been too high. Mostly, it's this awful cough and his difficulty breathing, especially at night. During the day, he seems a bit better, but still has that cough.
I see. How old is Milan?
He's 3 years old.
And when did these symptoms begin exactly?
It started 2 nights ago. During the day, he had a bit of a runny nose, but it wasn't anything serious. Then, in the middle of the night, he woke up with that terrible cough and seemed to be struggling to breathe.
Have you noticed any triggers that might have caused his symptoms to worsen?
Not really. We haven't done anything out of the ordinary. It just seemed to come on suddenly.
Thank you for the details. Has Milan been around anyone who has been sick recently?
Not that I know of. We've been quite careful with hygiene and social interactions lately.
Understood. Could you describe a specific incident when his symptoms were particularly severe?
Yes, the night before last was the worst. Around 2 a.m., he woke up crying and coughing. His cough was so loud and harsh that I thought he was choking. When I went into his room, he was gasping for air between coughs. I picked him up and tried to comfort him, but he just kept coughing. I took him into the bathroom and ran a hot shower to create steam, which seemed to help a little, but he was still having a hard time breathing. It was terrifying.
That does sound very frightening. You did well by using steam. It can sometimes help ease the symptoms. Did you try any other remedies or medications at home?
Yes, I gave him some children's acetaminophen to help with the fever and tried to keep him calm. I also used a humidifier in his room last night, which seemed to help a bit with his breathing, but the cough is still very bad.
It sounds like you've done a good job managing his symptoms so far. Based on what you've described, it sounds like Milan might have croup, which is a common viral infection in young children that causes swelling in the airways and leads to that distinctive barking cough.
Oh, I've heard of it before. Is it serious?
It can be quite distressing because of the breathing difficulties and the sound of the cough, but it is usually manageable and often resolves within a week. The main concern is to ensure that his airway remains open and that he is able to breathe comfortably. It's typically caused by a viral infection, often the same viruses that cause the common cold.
What causes it to sound so harsh? It's really alarming.
The harsh, barking sound of the cough is due to the swelling of the vocal cords and the windpipe, which causes a narrowing of the airways. When air is forced through this narrowed passage, it creates that characteristic sound.
I see. Is there anything specific I should be doing to help him recover?
Yes, there are a few things you can do to help Milan. First, keep him calm and comfortable, as crying and agitation can make the symptoms worse. Using a cool mist humidifier in his room, as you did, can help soothe his airways. Make sure he stays hydrated by encouraging him to drink plenty of fluids.
What about medication? Is there anything that can help with the coughing?
If Milan's symptoms are severe or if he has difficulty breathing, we might consider a dose of a corticosteroid, which can help reduce the inflammation in his airways. This medication usually works within a few hours and can make a significant difference. In some cases, a nebulized epinephrine treatment might be necessary, but this is typically reserved for more severe cases and would be administered in a hospital setting.
Thank you, Dr. DA. I really appreciate it. How long should I expect the symptoms to last? You hear a diabetic nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How are you doing today?
Good morning, Nurse Feather. I've been feeling a bit overwhelmed lately, but I'm managing. I'm here for my follow-up visit.
I understand. It can be a lot to take in. Let's go over how you've been feeling. Can you describe any specific symptoms or changes in your health since your last visit?
Well, I've been experiencing some fatigue and occasional dizziness. My vision gets blurry at times, and I've noticed that my wounds take longer to heal.
Thank you for sharing that with me, Mihira. These symptoms are common with diabetes, but it's good you're monitoring them. Let's review your test results now. Based on your recent blood work, it appears you have type 2 diabetes.
I had a feeling that might be the case. What does that mean for me?
Type 2 diabetes means that your body doesn't handle insulin effectively, which leads to elevated blood sugar levels. We'll need to start managing this with medication and lifestyle changes. For medication, your doctor has prescribed glucophage. It helps to control blood sugar levels by improving how your body uses insulin.
Okay. Will it have any side effects?
Some people experience digestive upset like diarrhea or nausea. It usually goes away after a few days. It's important to take the medication regularly as prescribed.
Okay, and what about my diet? Do I need to make any specific changes?
Yes, diet plays a crucial role in managing diabetes. You'll need to follow a low-sugar, low-carbohydrate diet. Focus on eating whole grains, lean proteins, vegetables, and fruits with a low glycemic index. It's also important to avoid sugary drinks and processed foods.
That sounds manageable. What other lifestyle changes do I need to consider?
Regular physical activity is very important. Aim for at least 30 minutes of moderate exercise, such as walking or cycling, most days of the week. Additionally, maintaining a healthy weight is crucial, so we'll work on a plan that includes both diet and exercise to help you reach and maintain your target weight. The aim should be to bring your HbA1c level below 7% over the next few months.
I see. Is there a specific blood sugar level I should aim to maintain?
Yes, you should aim to keep your blood sugar levels between 80 and 130 milligrams per deciliter before meals and less than 180 milligrams per deciliter 2 hours after starting a meal. Consistently monitoring your blood sugar levels will be key in managing your condition.
That sounds reasonable. Is it possible to reverse type 2 diabetes?
For some individuals, it's possible to achieve remission, meaning normal blood sugar levels without the need for medication. This often requires significant and sustained lifestyle changes, including weight loss and regular physical activity. However, it's important to understand that diabetes management is a lifelong commitment. Even if you achieve it, ongoing monitoring and healthy habits are essential to prevent a recurrence.
Thank you, Nurse Feather. I feel more informed now and ready to take the necessary steps. That is the end of Part A. Now look at Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihira talking to a nursing manager. Now read the question. Miss Georgina, I've noticed a recurring pattern of extended breaks among the night shift staff. It's impacting patient care. For instance, during the last shift, Nurse Patel was absent for nearly 30 minutes, leaving patients unattended. Additionally, there's been a rise in medication errors, which I suspect might be linked to fatigue caused by these prolonged breaks.
Mihira, this is a serious concern. Extended breaks are unacceptable, especially on night shifts. Medication errors are a major red flag. We need to address this promptly. I'll schedule a mandatory staff meeting to discuss break policies and their implications. It's crucial to emphasize the importance of patient safety and accountability. We'll also implement stricter break schedules and random checks. Mihira, I want to assure you that we're taking this matter very seriously.
Now look at question 26. You hear a physician talking to a nurse called Mihira. Now read the question.
Mihira, I need you to adjust the dosage for Mr. Dillon in room 303. The new medication, carvedilol, seems to be interacting with his existing diuretic, leading to hypotension. Let's reduce the carvedilol by 25% for now. Monitor his blood pressure closely over the next 24 hours. If it drops below 90/60 systolic, we might need to discontinue it altogether. Also, keep an eye on his potassium levels. Diuretics can sometimes deplete potassium, which can exacerbate the hypotension. If his potassium falls below 3.5, Mihira will need to supplement it.
Understood, Dr. Peter. I'll adjust the medication order immediately and inform the pharmacy. I'll also initiate blood pressure monitoring and potassium level checks. I'll keep you updated on any changes. Now look at question 27. You hear a nursing manager called Mihira talking in a morning meeting. Now read the question. Good morning, team. I have an important announcement. To enhance patient safety and accountability, we're implementing a biometric system for entry and exit from the ward. This means you'll be required to scan your fingerprint to clock in and out of your shift. I understand there might be concerns about privacy and convenience, but this system is essential for maintaining accurate staffing records, improving patient care, and ensuring compliance with regulatory standards. We've chosen a highly secure system that protects your biometric data. There will be a mandatory training session next week to familiarize everyone with the new system. If you have any questions or concerns, please feel free to approach me or the HR department. Now look at question 28. You hear two nurses talking in a ward. Now read the question.
Did you hear about the new admission, Mihira? They brought her in with severe pneumonia. She's in room 302. Apparently, she's an elderly patient with a history of heart problems. They're concerned about her oxygen levels dropping, so we need to monitor her closely. Also, she's on a bunch of medications, including diuretics, which can mess with her potassium levels. Mihira, we need to watch out for signs of hypokalemia.
Pneumonia and heart problems, that's a tough combo. We'll have to be extra vigilant. I'll check on her oxygen levels every hour and make sure she's comfortable. Let's also double-check her medication administration times to avoid any conflicts. We should probably get a blood test to check her potassium levels as well. Poor thing. Hope she recovers quickly. Now look at question 29. You hear a doctor talking to a junior doctor called Mihira. Now read the question.
Mihira, we need to be more selective about our wound dressings. Alginate dressings are great for absorbing exudate, but they can be expensive and difficult to remove. Hydrocolloids are good for autolytic debridement, but they can't handle heavy exudate. For those patients, consider hydrogels or foam dressings. Remember, the key is to choose a dressing that matches the wound's specific needs. For instance, if there's a risk of infection, silver dressings might be beneficial. Also, don't forget about the patient's comfort. Hydrocolloids can be quite adherent, which can be painful to remove.
Got it, Dr. Paul. I'll make sure to assess each wound carefully before choosing a dressing. I'll also keep the patient's comfort in mind. Thanks for the guidance. Now look at question 30. You hear a nurse talking to a patient called Mihira. Now read the question.
Hi, Mihira. I wanted to talk to you about your medication. The doctor has decided to switch you from the liquid form of your medicine to a tablet. It's the same medication, just a different form. The tablets are easier to swallow and might have fewer side effects. We'll start you on a lower dose of the tablet and gradually increase it to match your current dose. It's important to finish the liquid medication before you start the tablets to avoid any gaps in your treatment. Also, remember to take the tablets with food to help with absorption. Do you have any questions?
So, I'll finish the liquid stuff first, then start the tablets. And it's okay if I eat something with them?
That's right, Mihira. We want to make this transition as smooth as possible for you. Please let me know if you experience any side effects or if you have any trouble swallowing the tablets.
That is the end of Part B. Now look at Part C. You hear a plastic surgeon talking about advancements in cosmetic surgeries at the Mihira Research Center. You now have 90 seconds to read questions 31 to 36. The field of cosmetic surgery has experienced significant advancements over the past decade, particularly at the Mihira Research Center, a leading institution renowned for its cutting-edge research and innovations. These advancements encompass various aspects, including surgical techniques, non-invasive procedures, patient safety protocols, technological integration, personalized treatment plans, and post-operative care. Each of these areas has seen remarkable improvements, contributing to better patient outcomes, enhanced safety, and more natural-looking results. In this detailed exploration, we will delve into these 6 critical aspects, discussing the complexities and multifaceted nature of each, as they represent the forefront of cosmetic surgery advancements at Mihira Research Center. The Mihira Research Center has pioneered several innovative surgical techniques that have revolutionized cosmetic surgery. One notable advancement is the development of minimally invasive procedures. These techniques, such as endoscopic brow lifts and keyhole surgeries for facelifts, significantly reduce scarring, recovery time, and postoperative complications. The center's researchers have also perfected fat grafting procedures, where fat is harvested from one part of the body and transplanted to another to enhance volume and contour. This technique has been particularly successful in breast and buttock augmentations, offering a more natural alternative to implants. Moreover, the use of 3D imaging and printing has allowed surgeons to plan and execute surgeries with unprecedented precision. Custom implants and grafts can be created to fit the unique anatomy of each patient, ensuring optimal results and reducing the risk of complications. Non-invasive cosmetic procedures have gained immense popularity due to their minimal downtime and reduced risk compared to traditional surgery. At the Mihira Research Center, significant strides have been made in enhancing the efficacy of these treatments. One such advancement is the use of high-intensity focused ultrasound, HIFU, for skin tightening and lifting. This technology targets deeper layers of the skin without damaging the surface, promoting collagen production and achieving a youthful appearance. Another breakthrough is the development of cryolipolysis, commonly known as fat freezing, which selectively targets and destroys fat cells without harming surrounding tissues. Additionally, advancements in laser technologies have expanded their applications in skin resurfacing, hair removal, and the treatment of vascular lesions. These non-invasive procedures are often complemented by innovative skincare products and regimens developed at the center, which enhance and prolong the effects of the treatments. Ensuring patient safety is paramount in cosmetic surgery, and the Mihira Research Center has set new standards in this regard. The center employs rigorous preoperative screening processes to identify potential risks and contraindications. This includes comprehensive health assessments, psychological evaluations, and detailed discussions about patient expectations and desired outcomes. Intraoperatively, advanced monitoring systems are used to track vital signs and ensure patient stability. The use of enhanced recovery after surgery, ERAs, protocols has also been a significant advancement. These protocols involve a multidisciplinary approach to perioperative care, focusing on pain management, nutrition, and early mobilization to speed up recovery and reduce complications. Postoperative care at the Mihira Research Center is equally meticulous, with regular follow-ups, personalized care plans, and access to a range of supportive therapies to ensure optimal healing and satisfaction. Technology has played a crucial role in advancing cosmetic surgery, and the Mihira Research Center is at the forefront of integrating the latest innovations. One of the most impactful technologies is the use of augmented reality, AR, and virtual reality, VR, in surgical planning and training. Surgeons can visualize the procedure in a virtual environment, allowing for better planning and precision. Robotics has also made significant inroads in cosmetic surgery, particularly in procedures that require extreme precision, such as hair transplantation and microsurgery. The integration of artificial intelligence, AI, in diagnostic and predictive analytics has further enhanced patient outcomes. AI algorithms can analyze patient data to predict potential complications and optimize treatment plans and personalized care. Additionally, the use of telemedicine has expanded access to expert consultations and follow-up care, making it easier for patients to receive specialized care regardless of their geographic location. Personalization is a key trend in modern cosmetic surgery, and the Mihira Research Center has been a pioneer in this area. Every patient is unique, and personalized treatment plans are designed to address individual needs, preferences, and anatomical characteristics. This approach begins with a thorough consultation, during which detailed imaging and simulations are used to visualize potential outcomes. Genetic testing is also employed to understand how a patient might respond to certain treatments and to tailor interventions accordingly. Personalized skincare regimens, developed based on a patient's skin type and concerns, are another aspect of this approach. The center also offers personalized wellness programs, which include nutrition counseling, fitness plans, and stress management techniques to complement cosmetic procedures and promote overall well-being. This holistic approach ensures that patients receive comprehensive care that addresses both their aesthetic and health needs. The advancements in postoperative care at the Mihira Research Center have significantly improved patient recovery and satisfaction. The center has developed a comprehensive postoperative care program that includes pain management, wound care, and physical therapy. Pain management is tailored to each patient, utilizing a combination of medications, nerve blocks, and non-pharmacological methods such as acupuncture and relaxation techniques. Advanced wound care products and techniques are employed to minimize scarring and promote faster healing. Physical therapy is an integral part of the recovery process, particularly for patients undergoing body contouring and reconstructive surgeries. The center's physical therapists work closely with patients to develop customized exercise programs that enhance mobility and strength while reducing the risk of complications. Psychological support is also available to help patients cope with the emotional aspects of recovery and adjustment to their new appearance. This comprehensive approach ensures that patients achieve the best possible outcomes and experience a smooth and successful recovery. You hear a psychologist called Mihira being interviewed about the various aspects of her 30-year career. You now have 90 seconds to read questions 37 to 42.
Mihira, you've had a remarkable 30-year career in psychology. What initially drew you to this field?
My journey into psychology began quite unexpectedly. I was initially studying to become a teacher. During my third year of university, I took an elective course in developmental psychology, which sparked my interest in human behavior and mental processes. The intricacies of the human mind fascinated me, particularly how early experiences shape one's personality and coping mechanisms. I was deeply moved by the stories of resilience and transformation that I read about in case studies. This elective course changed my career path, leading me to pursue a degree in clinical psychology.
Over the years, how have you seen the field of psychology evolve, especially in terms of societal attitudes and technological advancements?
The evolution has been profound. When I started, there was a significant stigma attached to mental health issues. People were reluctant to seek help due to fear of being judged. Over the years, increased awareness and education have slowly chipped away at this stigma. Social media and online platforms have played a dual role. While they've helped spread awareness, they've also sometimes perpetuated misinformation. Technologically, the advent of teletherapy and mental health apps has revolutionized access to psychological care, making it more convenient and less intimidating for many people. Additionally, advancements in neuroimaging and genetic research have deepened our understanding of the biological underpinnings of mental health disorders, allowing for more targeted and effective treatments.
What has been the most challenging aspect of your career?
Without a doubt, the most challenging aspect has been dealing with the systemic issues that affect mental health. For instance, economic disparities often limit access to quality mental health care for many individuals. Additionally, cultural differences can create barriers to effective communication and treatment adherence. Navigating these complexities requires not only clinical skills, but also a deep understanding of social justice and advocacy. It's a constant balancing act to provide the best care possible while working within these constraints.
Can you share a particularly memorable case that had a significant impact on you?
There have been many, but one that stands out involved a young woman who was dealing with severe anxiety and depression following a traumatic incident. She was initially very resistant to therapy, which is not uncommon. Through persistent effort and building a strong therapeutic alliance, we were able to make significant progress. Over time, she learned to manage her symptoms and eventually regained a sense of normalcy in her life. This case highlighted the importance of perseverance and the profound impact of a supportive therapeutic relationship.
How do you maintain your own mental health while dealing with the stresses of your profession?
Self-care is paramount in this profession. I have a few strategies that I adhere to rigorously. Firstly, I engage in regular physical activity, which helps in managing stress and maintaining overall health. Secondly, I make sure to set boundaries. I have specific times when I am available for my clients and times when I am not. This helps in preventing burnout. Additionally, I seek supervision and peer support. Discussing challenging cases with colleagues can provide new perspectives and emotional relief. Lastly, I practice mindfulness and meditation, which have been invaluable in maintaining mental clarity and emotional balance.
Looking forward, what changes or advancements do you hope to see in the field of psychology?
I hope to see a continued reduction in the stigma associated with mental health issues, leading to more people seeking the help they need. Technologically, I am excited about the potential of artificial intelligence in personalizing treatment plans. AI could analyze vast amounts of data to provide insights that are beyond human capability, making treatments more effective. Furthermore, I would like to see an increased focus on preventative mental health care, integrating mental health education into early childhood education to build resilience from a young age.